Hello, I'm Hartford Healthcare's Tina Verona. Well, it's a topic that can be embarrassing for women to talk about, but tonight we're going to address all facets of what happens after menopause. As the body changes, that can leave women with painful vaginal conditions. But laser technology is having dramatic results on the lives of many women. Joining me tonight is Dr. Christine LaSala. She's a urogynecologist right here at Hartford Hospital. Dr. LaSala, thank you so much for talking to us about such an important topic and one that's not often talked about because it's embarrassing. So we're gonna tackle this tonight. But first, let's rewind a little bit, talk about menopause and how the body changes. Menopause essentially is a depletion of estrogen.
Correct.
So let's talk about what happens to the body. How does this change occur?
And I am so happy to be here and to be able to talk about this, because this is a problem that women suffer from, and really one of the many problems that they suffer in silence. So I am happy to be here and to say things are looking up for us. So when we go through menopause, estrogen levels decline. That's the definition of menopause. So estrogen is so important in our bodies. It gives us just a sense of well-being, but specifically, estrogen on the vagina keeps the vagina moist and elastic and pliable and healthy. It keeps the vagina, the bacterial environment in the vagina, normal. It acts on the bladder and the urethra to keep the bladder and the urethra calm and not irritated. So when we go through menopause and as the estrogen levels decline, the vagina and the bladder and the urethra feel it. So the symptoms are dryness, itchy, irritated. Do I have an infection? I don't know. Sex hurts. It's like scratching. It can be very dramatic and very uncomfortable. Urinary urgency, I gotta go. I'm going more frequently. I'm feeling my bladder. This all happens, and it doesn't happen overnight. It happens gradually over a few years, but it happens to all of us. So it bothers all of us, and it's just a matter of how much does it bother us, how much we'll tolerate. Because it's the next phase in our lives. Menopause happens in our late 40s, early 50s, and then we've still got 30 to 40 years left to live.
Right.
So we're living a good part of our lives in the postmenopausal condition with loss of estrogen.
So we're getting a couple of questions here already on Facebook. I know this is going to be a popular topic tonight, so we're going to try to get to all of your questions. Susan said, what signs are indicative of pelvic prolapse, both bladder and vaginal? Thanks, Susan.
So that's a great question, because that's another very common condition. That's not only menopause. We see it more often after menopause, but I've got some 35 and 40-year-old women in my practice. So the classic symptom of the uterus dropping or the vaginal walls dropping is I feel a bulge. I wipe and there's something there. I'm in the shower and I'm showering and there's something there. So you're not really touching the bladder, you're touching the vaginal wall, but it's the bladder that's bulging down into the vagina. If you feel something putting pressure on, if you feel something a little firmer, it might be the uterus that's dropped. And that's common. I mean, that happens in 4 out of 10 of us.
Yeah.
And that's another common condition.
So we have another question from Susan Smith. She says, she asks, do you have to be menopausal? That's a good question.
No, that's a good question. Yeah. So vaginal dryness, no, you don't have to be menopausal. It's much, much more common when we're perimenopausal, when we're going through the changes. But, you could be 40 and have vaginal dryness. So the condition of vaginal dryness usually is estrogen deficiency. Not always, and that's why when we talk about these conditions, these troubling conditions, we always say, well, we know it's likely to be estrogen deficiency, so for treatment, let's get the estrogen back. And it can be local vaginal estrogen. You don't have to do a patch or a pill. It could be local. That's where we need it. We need it in the vagina where the bladder sits and where the urethra is. So you've got dry skin, you apply a topical moisturizer, same thing with the vagina. that being said, women hear the word estrogen and they get scared.
Right, right.
And I understand that, you know, estrogen, oh no, estrogen causes cancer, estrogen. So it doesn't necessarily cause cancer. That's not always true. But I can understand if a woman has had breast cancer or has had uterine cancer, she doesn't want to go the estrogen way. It's been studied. The American College of OBGYN has actually said, you know what? In women who've had a history of breast cancer, vaginal estrogen does not cause a recurrence. You know, we can take a deep breath, such that if you're suffering from, you know, significant pain with sexual relations, with irritative urinary symptoms and burning, estrogen is okay to use.
Yep.
But I understand if you don't want to entertain that.
Right, absolutely. So I want to get into the treatment side of this.
Yes.
We want to talk about something that's called the Femme Touch laser, and this is for vaginal rejuvenation for a woman. Explain this, because this is really a game changer for women with these debilitating conditions that could be affecting their relationships with their significant other, and can be painful and horrible to live with, but you don't have to live with it.
And that's why I'm so excited about this, because this has been looked at really relatively recently over the last couple of years. And, you know, initially I was like, all right, I don't know, let's get some studies out there. Let's see the evidence. I'm not going to jump on a bandwagon. So when the evidence started to come in, that's when I said, oh, you know, this is real. So, what the laser does, it's a vaginal laser. So it's kind of like you go to your GYN appointment and, you know, a speculum gets inserted when we get our pap smears. So the laser gets inserted vaginally. It does not hurt. I mean, I'll tell you, I have had it done because I'm going through all of this stuff. So I said, okay, you know, I know what my patients are going through. So I had it done. So it does not hurt. The probe goes in vaginally, and the laser beams act on the vaginal lining. And it's so neat because what it does is it brings new blood supply back to the vaginal lining. It stimulates collagen production. You know, we know collagen, you know, helps our face and prevents wrinkles. Well, you know, it does the same thing vaginally. Right. So it increases collagen production. It brings vascular supply, blood supply back to the vaginal wall. And it literally, if you think of the vagina as a sponge, before we go through menopause, when we're in our 20s and 30s, imagine a nice new sponge. It's kind of moist and soft and spongy. Then imagine the menopausal vagina, or the woman who's had chemotherapy for breast cancer, or who's had radiation therapy for cervical cancer. Now imagine that sponge dry and old. And it's not spongy, it's not stretchy, it's dry and it's scratchy. And that's what happens to us. So the application of the laser brings the blood supply back, makes the tissue spongy again. And we see it with the naked eye, we see the changes. And in the studies that have looked at the vaginal lining under the microscope, the before laser and the after laser, it's dramatic.
Yeah.
It's dramatic.
What about for a woman who's premenopausal and is having these conditions? Would you suggest this procedure or to wait after she goes through menopause?
So that's a good question, and it depends on how much does it bother her. And when women come to see me, you know, we assess the whole problem. If it's really because she's got vaginal dryness and she's tried the Astroglide and the KY jelly and it's not helping, I wouldn't say for her to wait. Right. You know, if she's suffering now, I wouldn't say wait. Right. I would say, let's see what we can do now. You know, and you know, I am a pro vaginal estrogen person because it really does help. So you know, we'll always explore, why is this happening to you? Many women will benefit. I'm scientifically based, so I wouldn't say, oh, come for the mommy makeover and get your vaginal laser, because there's no data on that. Right. Not yet, anyway.
And that is one thing that's trending now. You often hear about vaginal tightening. This is not the same thing.
No, it's not the same thing. You know, if a woman comes to me and says, I feel really loose, because I see that a lot, the first thing I'll say is, let's go over your Kegel exercises. Let's make sure you're doing it right. Because oftentimes women feel loose because their pelvic floor muscles are open. So the laser isn't really, it's not tightening the pelvic floor muscles.
Right.
You know, I wouldn't go there for that reason.
Right. At least, you know, initially, if somebody comes in and says, oh, I need to be tightened vaginally, it probably can be done through exercises.
It can be done through exercises. And sometimes, you know, if we've had a couple of vaginal deliveries, things do stretch.
Right.
So sometimes, yes, we can do a little nip tuck. You know, we can restore the anatomy.
Sure.
You know, there's pros and cons to it because it is, in that case, it is a surgical procedure.
Right.
You know, so there's always pros and cons, and it's elective. So, you know, we're careful about that.
And that should be the last resort, too. I mean, you want to really look and evaluate each patient on a case-by-case basis.
Absolutely.
And because, like you said, it could be rectified through Kegel exercises or strengthening that pelvic area.
Right, just getting knowledge on how to exercise those muscles well. And we work with pelvic floor muscle trained physical therapists who can do more beyond the Kegels that I can teach them. So we've got a great group of physical therapists that we work with. The other thing that the feminist side of me will say is women will say, my husband or my partner says I'm too loose. Okay, so let's do the exam. And many, many times they've got beautiful anatomy. They're not too loose. So I'll say, Bring your partner in. Let's see what's going on with him, because maybe it's not you. You know, because, you know, as men age, you know, they have some erectile dysfunction as well. And it's not fair that we should always be blamed.
Right. And we do have another question here from Joanne. She's asking what procedures can be used to stop the, quote, leaking. Thanks, Joanne.
Yep. So if the leaking is, I leak when I laugh, cough, sneeze, that's different than urge. I gotta go now, or I'm gonna wet my pants. That's a different scenario. Treatable, but if you're having problems with exercising, laugh, cough, sneeze, things like this, the best studied and probably the most effective procedure that we have is this great outpatient procedure. It's a tape procedure or a sling procedure. It takes literally, it's under a half an hour. It's not painful. It works immediately, and it's a little sling that we place underneath the urethra. It's a little vaginal incision. We place this sling under the urethra. We anchor it to the groin muscles or the behind the pubic bone. We don't pull the sling tight because you don't want it too tight. You won't be able to pee. And it acts as a sling or like a backboard. So when you laugh and cough and sneeze, when the bladder and the urethra are trying to drop, the sling helps to keep the urethra supported and closed.
You know, I'm happy that we're getting so many questions from women who are asking. It just goes to show you that
it's out there.
It's out there, and I'm so happy to see that women are asking questions.
So am
because
I.
There is sort of a stigma. It's embarrassing to talk about, but I'm so happy to see all these questions. So Susan Kelly, let's see. We have a question before we get to Susan again. Kelly asks, what if you have frequent airiness and pressure but no dryness?
If you have frequent
airiness, looks like air and pressure, but no dryness.
For the laser, so we would do an exam because depending on what we see, even though you might not be dry, if the vaginal tissues are thinning out and it's uncomfortable, you're still a candidate for estrogen or laser therapy. You know, the key thing is, let's do an exam. Let's see what's happening there.
Oh, it was, I'm sorry, frequent urination.
So frequent urination, that's a great thing because that is so common. You know, and it's really bothersome, especially working women. You know, we can't be spending our time running back and forth to the bathroom. So again, is it a bad habit? Sometimes what happens, we get into this habit where we don't want to leak. We don't want to leak urine. So you know what? We're not going to pass up a bathroom.
Right.
So we kind of get into this habit, well, let me not pass up a bathroom because I don't want to leak. And then what happens is we kind of shrink our bladders. We don't let our bladders hold. And then over time, the bladders won't hold.
Bladders won't, yeah.
You know, so it's this vicious cycle. Urinary frequency, as we start going through menopause, again, the estrogen levels decline. The bladder and the urethra love estrogen. And when the estrogen levels decline, you feel your bladder more.
Right,
you know,
right.
you notice it. You know, so you go more often. So sometimes we'll say, don't give in. We do bladder retraining. Don't give in. Make yourself hold it. Retrain that bladder, mind over bladder. Sometimes vaginal estrogen. The laser has been shown to significantly reduce urinary urgency and frequency. And again, speaking from experience, it really does, because it brings the oxygen, it brings the blood supply back to the vagina, and the bladder and the urethra sit right on top of the vagina. So it's effective for that. What are you drinking? If you're drinking copious amounts of Starbucks lattes, caffeine is an irritant. You know, tea, caffeine is an irritant. You know, somehow we've been told, drink lots of water, it's good for you. It's never really been scientifically proven.
Right.
So the more we drink, the more we pee. So sometimes it's a matter of, all right, let's just make some lifestyle and behavioral changes.
Right. So we have a question from Susan. It's a follow-up question. What are the signs of bladder prolapse?
So bulge, women will say, I wipe and there's something there. That's the most common symptom. The other symptom is, I really feel like I need to pee, but then I sit down and not much comes out. Or I sit, I pee, I stand up, I sit down again, because I don't feel like I'm emptying my bladder. Because if the bladder is not in the proper position and it's kind of dropping down in the vagina, there's a chance you're not emptying completely, or at least you feel like you're not emptying completely because your bladder's not where it should be.
For women going through menopause, are there any diet, lifestyle modifications that can help reduce some of these symptoms in any way?
That's a good question. You know, there was the whole big push for soy, because soy is an estrogen equivalent. And in the end, it didn't help reduce hot flashes. It is an estrogen equivalent. So you know what? If you've had breast cancer or at risk for breast cancer, it's risky to take.
Right.
You know, we all know that overall good health helps relieve the symptoms. Smoking is horrible. You know, just smoking is just bad for everything. All the way around. All the way around. So, you know, in this day and age, no to smoking. Good sleep habits. Well, that's an oxymoron. We're having hot flashes.
Right.
We're not sleeping well.
Right.
How are we going to function during the day?
Right.
So there's been some small studies on black cohosh, you know, which is an herbal remedy that has been studied and has been shown to at least reduce hot flashes and improve sleeping habits. You know, put a fan on. You know, dress in light pajamas, if any. You know, treat those kind of conditions.
Andrea says, when I have to go, I can't hold it. Is there a treatment for that?
Yep. So, and unfortunately that's really common, and we call it oftentimes the key in the door sign. I'm fine, I get home from work, I go to put my key in the door and it's like, oh crud, you know, I'm holding myself and I'm running to the bathroom.
That's not a good thing.
That's not good. So again, what are you drinking? What types of fluids are you drinking? Smoking, because nicotine is a bladder irritant. Are you menopausal? You know, what is the condition? Because we know that estrogen deficiency increases urgency frequency. So, you know, we look at what are you doing? What are some of the things we can do to change that? There are some medications. You've seen them on TV. The overactive bladder medications. They are helpful. They're not perfect, but they reduce 70%. They improve the symptoms by 70%. So there are some of the medications out there. You know, there's different types, different side effects. So sometimes it's trial and error. There are newer treatments for overactive bladder, which are really neat. It's kind of like acupuncture, It's an office procedure where we place a wire behind the ankle, because there are nerves that feed the bladder that go directly to the bladder, and then there's nerves that go down towards the ankle and then up to the bladder, and we can kind of stimulate those nerves. We put a wire next to those nerves. You don't even have to get undressed. It's called percutaneous tibial nerve stimulation, PTNS. So you sit there, and I say that 10 times fast, and we send the frequency through that wire. And it doesn't hurt. You kind of feel like a zzz kind of a feeling, and it indirectly acts on the nerves that feed the bladder, that ultimately allow the bladder to hold more urine. So if you're able to more comfortably hold more urine, you're voiding less frequently. So that's once a week for 12 weeks, and then once a month. Different insurances will cover it differently. Many insurances will say you have had to have tried 2 medications first before they'll pay for the PTNS. Then there's a third line treatment, which is a little more invasive, Botox for the bladder. It works great. It's not forever, so it's an office procedure. It's not very uncomfortable. It's a little pinchy. This I have not voluntarily done on myself, like some of the other things, but it takes about 2 weeks to kick in. We've worked with the dosing because we don't want to paralyze the bladder completely. So over the years we've worked with the dosing, and we've pretty much got the dosing figured out. So you come in, it takes about 2 weeks to kick in, but you're back to work, you're back to your life. There's no restrictions. And then it works very well, but it's not permanent. So usually by around 6 to 8 months, you start going back, you come back in, and we do it again.
But the beautiful thing about all of this is that there are minimally invasive procedures. We talked about the Femme touch laser, we talked about Botox, we talked about other procedures that if you're having urinary incontinence, if you're going through menopause, if you're having bladder issues, there's so many treatments out there that can really address all of these conditions. So to all you women out there, you don't need to live with this. I think that's really the important message here. And I'm so glad that we got all these questions. And you know what? Keep the questions coming, because even long after our live Facebook discussion is over, we can certainly get these questions to Dr. LaSala, and we will respond to you on our Facebook page. So Dr. LaSala, thank you so much for joining us. I think this was really enlightening and good to see all of the feedback that we've been receiving. So thank you about this, and thank you for joining us.
Thank you all.
For these great questions that we've received tonight. And like I said, we can continue the conversation. If you have questions, just keep asking and we'll answer them for you. For Hartford Healthcare, I'm Tina Verona. We'll see you back here next week.